During this mini-webinar, we'll be discussing setting the stage for ensuring trans inclusivity. We'll be discussing this in the context of ADAP offices and medical settings. First, I want to talk about social determinants of health that create barriers to care and coverage, which lead to desperate HIV outcomes and impact within the transgender community. These look like social marginalization, legal marginalization, and economic marginalization. It's important that we understand these frameworks as we move forward to understanding the trans people and their experience. Specifically, I want to discuss the discrimination and stigma felt by transgender people. Starting on the left with the red bar, we see that transgender people have postponed care due to discrimination from a previous experience in a medical setting. 48% of transgender people postponed care due to financial barriers or costs, which may have been administrative or due to a denial in health insurance. 19% of respondents refused care due to their transgender or gender nonconforming identity, and the percent of people refusing care increased for people of color. 28% of respondents reported harassment in the medical setting, and a shocking 2% reported violence in the doctor's office. This information comes from the National Transgender Discrimination Survey, and they have highlighted other forms of discrimination and social barriers to receiving care, qualifying for housing, and other aspects of their life. When decreasing discrimination, it is essential to help transgender people navigate and access medical care. The prevalence rate of HIV among transgender people is estimated to be 50% of all transgender people. When interacting with a client who is transgender, gender nonconforming, or intersex, whether at the front desk or the doctor's office, it is imperative that the staff affirm their gender and use their preferred name and pronoun. What does gender affirmation mean? The National LGBT Health Education Center, a program of the Fenway Institute, produced a guide of best practices for frontline healthcare staff to provide affirmative care. The guide includes tips and strategies to improve communication and create a more affirming environment by first understanding transgender people. Key points to include are improved communication, procedural changes within the organization, and environmental changes to create a gender-affirming space. Starting with improved communications, it's key to maintain eye contact with the person. First ask, then use their preferred name and pronouns. Avoid using gendered terms like ma'am and sir, and apologize if you make a mistake. It will happen and it's okay, just apologize when it does. Then practice, using gender-neutral terms and their preferred name and pronoun. When speaking about organizational changes, first, an inclusive check-in procedure is key to treating transgender clients, as it's their first interaction with a staff member and sets the stage for the rest of their visit. When checking in, ask the client for their preferred name, gender identity, and preferred pronouns. And then be sure to use their preferred name and pronouns, along with documenting them to make sure all staff continue to address the person the way that they want to be addressed. It is important to remember that we are not all perfect, and mistakes will likely happen. Be sure to apologize when using the wrong name or pronoun. It does make a difference to your client. Revising the check-in forms and electronic health records help confirm the person's identity and ensure continued use of their preferred name, from reminder calls to time with the doctor during a follow-up visit. Some record systems allow custom fields to be added while others do not. When pre-formed fields are not available, try getting creative and innovative when documenting. As you can see on the slide, we've shown an example used by a clinic here in DC where they use lowercase for their legal name and all uppercase for their preferred name, seen here as Tyrone, they prefer to be called Tay-Tay. The World Professional Association for Transgender Health, or WPATH, have issued recommendations for EHRs and their transgender clients. It was later adopted by the CDC's two-step method, which is discussed later in our toolkit. All changes to become a more inclusive medical setting require staff buy-in and understanding. Training for new procedures, changes in staff, and regular updates on best practices should be incorporated into existing trainings and staff development activities. Other options include hiring consultants that identify as transgender and building relationships with trans-inclusive organizations in your area and jurisdiction. The physical environment plays a role in making people feel comfortable and welcome. These posters are two examples that could be hung in the lobby or in the doctor's office. Building trust with these populations is key.